Hi, this video is the demonstration of the FUT linear scar, and this is the demonstration of the FUT linear scar, or FUSS. It will leave you a linear scar, where the FUE leave you tiny dots of scar, allow you to shave your head shorter. Both methods leave you scar. There's always pro and con for both. The FUT is not just more linear scar and a more visible scar, but the FUT is more invasive, more painful during recovery, more chance of infection. But the benefit of FUT or the strip method are is cheaper, half price, because less labor, and the number of grafts we can do is more. We can do for that's why advanced hair loss tend to opt for the FUT or FUSS. The advanced hair loss will do so FUT we can harvest 4 to 6,000 grafts per day, where FUE we talk about 25 to 3,500 grafts per day. And the other benefit of the FUT or FUSS is not just cheaper, but actually and grow, and you can harvest more graft, but you can actually the per growth rate percentage. The FUT or FUSS has 5 to 10% more density than FUE. On the other hand, the FUE have their pro and con too. The FUE has basically the benefit are less invasive, less bleeding, less chance infection, is less painful during recovery. But the downside, the FUER is more expensive. The number of grafts we can do is less than the FUT. While the FUE can harvest 25 to 3,500 grafts per day, that's why it's more advantageous for a mild to moderate hair loss. Although it can be done for advanced hair loss, you just need multiple surgery. Where the FUT or FUSS can harvest 4 to 6,000 grafts per day. The FUE can harvest 25 to 3,500 grafts per day. So more expensive, harvest less number of grafts, and the percent growth rate, the FUE percent growth rate is 5 to 10% less than the strip method. Now, both I can give you very good density with the FUE and the FUT. But if you compare my FUE to my FUT, the FUE is 5 to 10% less density. But you compare my FUE to a lot of clinic that does FUE or FUT, my density is still better. So this is the demonstration of the FUT strip method linear scar.